A growing number of Canadians, including Carol Ann Sevier, say their questions are answered. They want the vaccine.
Yes, they absolutely are, and I'll be there with my sleeves rolled up.
A new survey found nearly half of Canadians want a shot immediately instead of waiting. That's an 8% jump since last month. But how quickly you'll get it may depend on where you live. Some provinces plan to hand out most, if not all, the initial vaccine doses they receive, even though each person requires 2 shots.
We have good protection even after the first dose.
BC says we aren't holding back doses because we want to protect as many people as possible, as quickly as possible. Saskatchewan and New Brunswick have similar pilot plans. Ontario says it is reserving half its doses for now.
I don't actually know what the right thing to do is. Would you just give twice the people 1 dose? I've heard some very compelling arguments for that.
Pfizer's trial data shows 7 days after the second dose, the vaccine was 95% effective in preventing COVID-19. But researchers also found between the first and second dose, nearly half of participants exposed to the virus still became infected, resulting in a vaccine efficacy of 52%.
The big downside of that kind of vaccination strategy is you have to make sure your second dose is showing up on time.
Ottawa says it's constantly in talks with vaccine suppliers, but nothing is certain.
We are still finalizing the precise numbers of the shipments coming next week and the weeks after.
I wouldn't want to take the gamble that I get one vaccine and may not get the second one.
In a statement, Pfizer says we're still learning a lot about the protection offered by COVID-19 vaccines. Its recommendation to the provinces, 2 doses per person guaranteed. Christine Birak, CBC News, Toronto.
Okay, so let's loop in Dr. Lisa Barrett now, an infectious diseases specialist joining us from Halifax. And Dr. Barrett, can you give us some perspective on this? I mean, does this feel like a reasonable gamble, especially given that the plan has always been to get 250,000 doses by the end of the month?
Right. So, spoiler alert, there's not one easy answer here. And certainly the reason that provinces differ is that each province is at a slightly different part, I think, of this pandemic and of the second wave. And so what I mean by that is, obviously the ideal is to have your first shot at the time you get your first shot and the booster available for sure, because we know that immunity does wane after a certain period of time, and the booster is an important part of making sure we have at least some durability of this protection. However, if you're in a situation where there is a great deal of community virus and you don't have a good handle on the spread, then it may be reasonable to vaccinate more people very quickly in hopes that you're going to head towards some sort of mass effect or herd type effect. The challenge with that is not many folks and not many provinces have enough vaccine to get to that herd impact. And therefore, some other provinces have decided to go with the guaranteed 2 doses for each person who starts the actual series.
Yeah, that is it is a tricky balance. Dr. Barrett, thank you for that. And you'll also be joining us later in the program to answer viewer questions about the vaccine. Thanks.